Huddle up for safer healthcare. A whistle-stop tour of safety huddles. We know that coming to hospital can be a scary prospect. This brief video aims to inform our patients and staff about the exciting work that we're doing to improve patient safety in Yorkshire and the Humber. Specifically, we're working with 3 hospital trusts, Leeds, Barnsley and York, along with our academic health science network to improve care through an initiative called Huddle Up for Safer Healthcare. We know that approximately 5 to 10% of patients experience harm in some form or another whilst in hospital. For example, some patients may fall, receive the wrong medication or develop pressure wounds. This is unacceptable to us. Whilst such events vary in their severity, we know they can have a devastating effect on patients, family and staff members. The good news is, however, we know that approximately 1/3 of such events are preventable. We know that to reduce patient harm, we need to change behaviours at the front line, starting with our ward teams. This video looks specifically at ward safety huddles, what they are, and the role they play in improving patient safety. The definition of a huddle, according to the Oxford English Dictionary, is to crowd together. In a hospital setting, a safety huddle is a brief, daily meeting of frontline ward staff to highlight, discuss, and try to reduce potential patient harms. So what does that mean in practical terms? Well, let's have a look at our ward to see a safety huddle in action. As we can see, the huddle is attended by all team members, including non-clinical staff such as our ward clerks and housekeepers. It is a brief meeting, held in a designated place at a set time. It is led ideally by the most senior clinician, whether this be a doctor or nurse, but most importantly, it's free from hierarchy, where the contribution of every team member is equal and heard. The team usually focuses on 1 or 2 safety concerns most relevant to their ward and their patients. They systematically highlight their patients who are most at risk, and as a team discuss options to minimise the possibility of an adverse event. In this particular example, the team have chosen to focus on falls, as they're based on a medical admissions unit for older people. The team starts by talking through up-to-date information they have, such as the number of days that have passed since the last fall. The team can then learn about any problems and celebrate improvements they may have made. They then talk through the patients who they're really worried about falling today, and together formulate plans to reduce the risk of falls. The team could choose to do a number of things, so in making their plans, they consider a range of options that have been backed up by research, such as appropriate footwear and mobility aids. They utilise the specialist knowledge that each team member brings. For instance, the medical team may be able to highlight a patient whose blood pressure drops when they stand, making them at risk of a fall, and the housekeeper may notice when a patient's glasses or slippers have gone missing. This too would make a patient more likely to fall. There are other examples. A pharmacist may have reviewed a patient's medication and in doing so may have been able to highlight drugs that could make them more likely to fall, such as a sleeping tablet. And the physiotherapist could identify that a patient has the wrong size walking stick. The aim of the safety briefing is to raise awareness amongst all staff members of the current risks so we can intervene before harm occurs. Having looked briefly at what a safety huddle is, let's look a little closer at what makes an effective huddle. There's no one-size-fits-all format for safety huddles, but it's important the team develop their own strategy for making the huddle their own and to make it work for their ward area and, most importantly, their patients. A huddle should be focused, concentrating on just 1 or 2 potential areas of harm. They should be informed by evidence. The team should have access to ward results to help understand whether improvements to patient safety are being achieved. Led by a senior clinician. Collaborative. Consensus should be reached by all team members over what the best course of action is. For example, if the team decide to use a fall sensor for a patient, or perhaps move patients who are at risk of falling into the same bay, all team members should agree that this is the right plan. They should be regular. The huddle should happen every day, including weekends, and should always be held in the same place. And it should be brief, usually between 5 to 15 minutes depending on the ward. They should celebrate. Milestones of success should be identified and celebrated. And they should involve all. Finally, all team members of the frontline staff should attend, including the clinical and the non-clinical staff. We all have a contribution to make. So now we know what safety huddles are and how they work, Let's look at what they can achieve. Our results so far show we've managed to significantly reduce falls on certain wards. Let's have a look at some of the evidence. This run chart shows the number of falls over 4 admission wards in Leeds Hospital Trust. As you can see, where we launched the safety huddles, there's an arrow. If you follow the line of the run chart, you see it trends down, simply demonstrating a reduction in the number of falls. One of our biggest successes has been one of our wards in Calderdale, which reached 50 days without a fall. Success must be celebrated, which is why we encourage ward teams to proudly display these certificates. By making our results visible, it helps keep all the team motivated and lets our patient know the improvements we're making. We're currently working to understand how safety huddles improve patient care and whether they can be rolled out on a much larger scale and still achieve such impressive results. We're keen too to know if our patients are seeing improvements. So what's next for safety huddles? Having demonstrated the potential for improvement and culture change from safety huddles on a small scale, we're now looking with our 3 hospital trusts to implement and assess the successes of safety huddles across whole hospitals. Well, that's the end of our whistle-stop tour of Huddle Up for Safer Healthcare. We hope this video has served as a useful introduction to safety huddles, what they are, and how they can be used to improve patient care. As we support all wards across our trusts to roll out safety huddles, we hope you'll be seeing lots more of these, proving we're making our hospitals safer.